Hi, this is Dr. Andy Droel, Droel Family Dentistry, here to say a few words about one of my favorite parts of this profession. One of the reasons I am really glad I chose this profession. The topic is helping people get caught up on their dentistry when they're way behind people that haven't been into the dentist for 10 years. It's commonplace for me to meet people who haven't been in for 15 years, just haven't gone to the dentist, or maybe gone in once and had a tooth removed because it hurt. But now want to get caught up, reestablish care, reconstruct what's missing. Oftentimes there's some damage and there's some things we need to do. And I just love welcoming people back to dentistry so we can make things as simple as possible to get people beyond dentistry again, back out into the world, and not having the whole thing of like dental health or compromised dental health hanging over them all the time. I just love it. So our process, you get here. Easiest way to get here is fill out the web inquiry form at the bottom of our website, and one of us will contact you. And please do identify yourself and describe your situation. We are the no judgment zone. We're happy to just tell us what's happened in the past so we can help understand good options for you in the future and try to slow down the damage. So tell us what's going on, get in the system, get in with one of us doctors. Oftentimes it's me, and what we do, we bring you to your first appointment. We know we're not going to get any work done at the first appointment. We're just going to get acquainted and get a really good baseline of where we're at. So, of course, that means the dentist is going to look in your mouth. But before that even happens, one of our team is going to start with you and talk to you for a few minutes about just background and everything. Go over the notes that you filled out before your appointment, which are really important because medical history oftentimes is a big player in what has gone wrong with dental health, and we have to figure that stuff out. We get photos. We get photos inside the mouth pretty quickly. Our team are pretty good at it for reference. And we also just get a scan right away. A scan is a three-dimensional representation of your teeth inside the cloud, inside our little system, so that even after you leave, we can keep thinking about things, which often we need to, because I'll have some follow-up to do with specialists or lab technicians, or even just think about things myself. So photos, scan, questionnaire. Then we will get ourselves up to date on x-rays. A lot of times, more recent dental patients that are just transferring here have x-rays sent here. If you haven't been into the dentist in 10 years, or you only went in once 5 years ago because you had a raging toothache and someone pulled your tooth, fine. We'll probably just take new x-rays because the old ones after 2 or 3 years old, they're not that important anymore. So we get all those, and then we start getting acquainted. This is the no judgment zone. I come in. Unfortunately, I have a mask on lately. We'll get to take off the masks for conversations at some point here, hopefully in the near future. But until then, I can get to know somebody with a mask on. And we'll probably look at pictures and talk conversation style with you upright, just you and I in the room for a while before I actually look in your mouth. Because all those things that I mentioned, the scan, photos and everything, and also just the information that you give us, they give me a pretty complete picture of what's going on. Of course, eventually I do have to look in the mouth, so I do that too. Then when we're looking in the mouth, we're looking for, basically, there are like 3 forces of nature that really do a number on teeth. Decay, everybody knows about decay. There's gum disease, periodontal disease, same thing. That's the force of nature that's in some people's mouths more than others, that the bone dies away around the teeth and the teeth get loose. Not cool. The bone around the teeth is really important. We also don't like inflammation in the body. So we're on the lookout for tooth decay, gum disease. And the third thing that can really do a number on teeth is tooth wear. Sometimes that's habits that people have, like grinding their teeth at night. Sometimes that's a lack of back teeth, making it necessary for the front teeth to do all the chewing and they wear down really quickly. That may be the case. And then we think about a fourth thing besides those 3. And that fourth thing is the medical dental connections. We don't solve medical problems here, but we're on the lookout for medical situations that might impact dental health, and vice versa. Dental health is a part of the rest of your body, and vice versa, right? So that might be a dry mouth from medications that you've been taking. It might be reflux. It might be sleep issues. Just different things that we want to be aware of. Because if we're going to be doing a significant amount of dentistry, we want to understand what's going on so that whatever we do, we want to make sure it's going to last. And so for decay, gum disease, tooth wear, and then the fourth thing, medical, dental connections, we really try and have those things understood before we start making changes, right? That's like diagnosis. Then we can start to take actions that slow down the damage. So we start to get tooth decay under control. And I don't just mean a lecture to brush more and floss more. I mean, figure out, why do you get all the cavities, and your brother or sister that's the same age, that grew up in the same house, doesn't seem to get very many cavities? Well, it's not fair. You probably have different mouth biology. You might also need to lay off the sugar, and we'll talk about that too. I'm a dentist, and so I'm going to bring up sugar, right? Gum disease, definitely some people are more prone to it than others. There's a genetic component, and we have to screen for that. I see people all the time that don't brush their teeth and don't get gum disease. It's amazing. And yet we tell everyone, you got to go brush your teeth. Well, I hope you brush your teeth, because dirty teeth are gross, but we have to be more sophisticated about what's actually happening. Tooth wear is kind of the same thing. We want to figure these things out before we start fixing things. Once it's time to start actually talking about dental treatment, I have to look at kind of like two things, basically, the upper arch and the lower arch. The teeth make arches. It's an arch, so we call it an arch. The upper arch, that's your top teeth. We look at how many of those are remaining. Are they in good enough condition to restore that we don't need to talk about replacing very many of them? In other words, can we keep the upper arch teeth as they are, or do we have to remove them all and figure out how to replace them with something like full implant supported denture, or a full denture with no implants, something like that. Lower arch, same thing. Are we going to be able to keep the teeth that are there? Are we going to be able to use those to support replacement teeth? Maybe drop in a couple of implants where teeth are missing? Or are they all loose, many of them missing, heavily decayed, something, just lots of damage, and we just can't use them anymore? And so therefore we have to figure out how to get them removed. From there, we just start making choices. There's always a simpler, less expensive, less awesome option. We can do, for 50 years more, and upper denture has been standard treatment for when you're missing all your top teeth, and there are a lot of happy upper denture wearers, but now we have implants to support those. If you're going to keep many of your upper teeth or many of your lower teeth, we're going to plug in fillings, crowns. We're going to get the surviving teeth clean if we need to. We're going to set up a good maintenance program. Maintenance. So that's basically diagnosis. When it's time to do treatment, we make everything ahead of time. We always make a mock-up of some kind, unless we're just working inside the mouth and making simple improvements to existing teeth. We don't have a lot of figuring to do. So if we're making replacement teeth for the whole upper arch, we're going to make a mock-up first that we can try in the mouth as well as we can. If we're redoing upper teeth with numerous crowns or something, veneers, we're going to make that ahead of time too, and then we're going to preview that at an appointment where we can look at pictures and hopefully do a three-dimensional try-in of the mock-up in your mouth. And I have a whole workflow that's a whole bunch of geeky dentist stuff that we go into with that. But that's the deal. There's your dental overhaul right there. It starts with that first exam. I'd say probably I get a lot of messages from people that they're telling me like, okay, doctor, I'm going to come see you, but I'm going to need a lot of work. I appreciate the heads up. Probably in at least half of those situations, I gather the information, we get acquainted. That appointment takes about an hour, and then we set something up about 2 weeks later where we can talk some more. And I'll usually give you something to go learn about. Go Google this and Google that. Go Google dental implants, and I want you to Google bridges and periodontal disease, and I'll tell you a few things about those. I'll say something like that, and I'm going to go stare at your scan and stare at the photos and try to figure out what makes the most sense. And I'm thinking, I'm like, okay, I got to think about this one. Sometimes it's a lot simpler and I can make a call at that first appointment, but whatever the case, we're going to give you options, and we're going to make sure you understand your options, and you're going to figure out what to do based on your resources, what you're actually looking for, your value system, all that. Those things are yours, not mine. So I'm just here to be a resource. Then I cannot overemphasize, and I put this at the end for those who are still watching, maintenance and prevention. That's the stuff that's going to keep you from getting into this situation again. And we bring our A game for decay control with custom mouth rinses, everything we can come up with, gum disease control, control against functional problems like tooth wear, night guards, everything we can do to set you up so you're only having to do this like maybe once and not every 5 years. We'd like for this to be the only time you have to get caught up when you're in this much need at once. So you made it to this page because you were curious, and you made it to the end of this video if you're really curious. Thank you for watching the entire thing. Not everybody does. Let's get acquainted. Go to our website. That's the easiest way. Scroll to the bottom of any page at our website. Type in your info. Make sure your info is correct so we can actually get a hold of you. Tell us about yourself, and we'll get you in and help you get squared away.